Good afternoon, and thank you for joining us on Health Talk TV. My name is Martae
And I'm Briana Carson.
And our health topic of the day is Alzheimer's disease. Alzheimer's is a progressive disorder that affects the brain, which is essentially part of the nervous system. It slowly destroys memory and the ability to carry out simple everyday tasks.
Alzheimer's is also a non-communicable, genetically inherited disease. Other ways a person is likely to acquire this disease is old age, having high blood pressure, or a history of head trauma. It is diagnosed by symptoms such as loss of memory, trouble performing tasks, poor judgment, inability to think and understand, and gradual changes in behavior.
1 in 8 older Americans has this disease. It is the 5th leading cause of death in those aged 65 and older. Women are also more prone to have this disease because of their tendencies to live longer than men.
There are many ways to prevent Alzheimer's and live a brain-healthy lifestyle. These include regular exercise, healthy diet, mental stimulation, sleep, stress management, and an active social lifestyle. Unfortunately, there are no cures for Alzheimer's. However, promising research continues to provide hope to reduce the risk of developing Alzheimer's disease.
Joining us later, we have a special guest who will give viewers insight on coping with Alzheimer's disease.
Hi, this is Briana from Health Talk TV, and today we have Nicole, who is going to give us an insight perspective on having a family member with Alzheimer's. So Nicole, who in your family has Alzheimer's?
My mother has Alzheimer's.
And when was she diagnosed?
She was diagnosed at the age of 59.
So what type of symptoms did you notice, or did you notice any?
We didn't really notice any symptoms because it didn't run in our family, so we didn't know what to look out for. The occasional missed keys, things like that we did just chalked it up as just a normal thing to forget. Other than that, there was really no signs until one day she just repeated a story to us, and we all kind of looked at each other strange, like she just told us the story like less than 2 seconds ago, and she didn't realize that she had done it. And at that point is when red flags came up, and we started paying attention a little bit more closely.
So what type of test did the doctors do on her?
They did cognitive skills type tests, dropping a pen, seeing if she can pick it up, and telling her when you pick up the pen, put it on the table, and those types of tests they did. They also did some scannings. They did some MRIs of the brain just to show the brain activity. It doesn't really necessarily mean that she has Alzheimer's. Basically, won't find that out until an autopsy is performed. Is when they'll find out for sure that this is in fact Alzheimer's.
Okay. So what type of behavioral changes did you first notice in your mom?
She became a lot more aggressive, and she has a tendency to do a lot of crying. She has a lot of crying spells, but overall she just became a lot more aggressive and agitated.
Okay. And so have you noticed anything, like things she can't do anymore?
Things that she can't do anymore would be, she can't get dressed. She can't dress herself. She has a hard time getting in and out of a car. She can't grasp the concept of bending her knees to get in. So basically, just taking care of herself. Those needs she can't do anymore without assistance. I mean, if she needs to brush her teeth, you have to put the toothpaste on the brush and put it in her mouth, and then she'll kind of catch on and know to brush her teeth. But if you just give her the toothbrush with the toothpaste, she'll probably, knowing my mom, she'll probably take the toothbrush and start brushing the sink, not her teeth.
Okay. Does she notice she has it? Does she notice?
Sometimes she goes, I call it like she goes in and out. Sometimes I can sit down and I'll ask her, Mom, do you know why you do the things that you do? And she'll say yes, and I'll say why? She'll say because I have Alzheimer's. And then sometimes she doesn't know. She doesn't know what's going on. But there are moments, and I think she's just at a stage where she can kind of go in and out, but eventually it'll progress and she won't know what's going on.
What type of advice would you give to anybody trying to deal with having a loved one with Alzheimer's?
That's a loaded question. But the only thing that I could recommend to someone that's going through this with the Alzheimer's patients is just to be very patient, because they don't want to be this way. So to fuss and get frustrated and angry because they don't know how to put a spoon to their mouth, it's not necessary. But they reading articles and little research things that I've read before, they say that the caregivers of Alzheimer's patients have a really hard time with it, because it's mentally and physically exhausting, because you're telling this person over and over and over again, no, don't do that, no, don't do that, or come over here, and at least when you tell a child this, no, don't do that, come over here, eventually they'll learn, and then you don't have to do this anymore. But with these types of patients, they're going to keep doing it over and over again. So a lot of the caregivers become abusive to their loved ones, and there's a lot of articles on that. They become abusive, start to beat them, hit them, don't feed them, just to try to punish them, thinking that that's going to make them learn. Well, if you don't come and get this food, then I'm not going to feed it to you. You're going to have to learn. They're at a point that they're not going to learn. So the only thing that I can recommend is just be patient. If you need to talk to somebody, talking helps tremendously. And they also have organizations that you can go and talk to people, and like a little meeting for everybody to get together and just discuss their problems, that share the problems that everybody's going through together, and it kind of helps that way.
Okay, well, thank you, Nicole. Thank you for joining us. This is Health Talk TV. I'm Briana Carson.
Thank you for joining us on Health Talk TV. For more information on Alzheimer's, visit the Alzheimer's Association at www.alz.org.